We understand that everyone wants to know, when will it be my turn to get the COVID-19 vaccine? Right now, we in San Mateo County are in the phase that's trying to assure that healthcare workers, the first priority population designated by the federal government and which the state aligned, make sure that they are vaccinated so those who have been most exposed to the virus are protected. Also, residents of long-term care facilities and staff who work in those settings are in that first population and being vaccinated through a federal partnership with pharmacies. Much of the vaccinating is and will continue to occur through multi-county entities, the major healthcare system partners like Kaiser and Sutter, that are mobilizing and have largely vaccinated all of their healthcare workers in San Mateo County and across the regions. For each of you, the best route remains to contact your primary care provider, your healthcare system, to understand when is your turn. Our role is to coordinate and be a backstop and a safety net for those who don't have a direct pathway to the vaccine through one of the major healthcare systems. If you don't have a primary care provider and are vulnerable, the homeless, those who have been marginalized and excluded and may not have a trustful path to get the vaccine. For all of you, your primary care provider continues to be the best path to obtain a vaccine. There will be new information that they're adapting to every day. Because they might not have the information today doesn't mean you don't keep checking back to see when your turn may come up. Our Board of Supervisors has been clear-eyed and focused to make sure that equity is at the core of how we approach our role, so that those who have the least protection and are the most vulnerable can count on the county to be a pathway so that everyone can be protected. We continue to monitor the situation very closely to adapt the approaches that San Mateo County mobilizes. We have as our highest priority the rollout and support of this massive effort so that every resident will eventually be able to be vaccinated. We also seek to continue to provide clear and consistent information in an environment in which the major healthcare providers are working as hard as they can on all of our behalf, and we have a special responsibility as a safety net and a protection for those who are the most vulnerable and have been the most exposed throughout the pandemic. That will continue to be our focus.